Hi, I'm Ryan Hunter, and this is Kalispell Connections, a program where we talk about issues important to the community. And with me today is Micah Hill, the new Kalispell School Superintendent. Welcome, Micah.
Thank you, Ryan. Thanks for having me.
Yeah, I have to start by saying I don't envy you. Starting as the new superintendent during a pandemic is extremely challenging, I know. So thank you for stepping into the position at such a challenging time and doing the hard work preparing for the fall session. Could you start by providing just a brief sketch of what reopening will look like in the fall and kind of the guidelines you're going on?
Sure. So what we currently have is a phased reopening plan where we identified it specific phases. We used the governor's guidance, we used OPI's guidance, we used CDC's guidance, which interestingly enough, if you were to lay all three of them out, you're going to find discrepancies in what is being recommended, what is required, what is feasible. It's all over the place, and it's really put the superintendents, at least in this valley, and probably nationwide, in a really tough spot because I was at a meeting the other day and we were making introductions, and we had the CEO of the hospital and the county health department and infectious disease nurses and epidemiologists, and I said, I have a degree in English, and you are asking me to construct a plan based off of a lot of different things. So that being said, we developed a guideline with phases, and our guidelines right now, we're going to open up in phase 2, which mirrors what the governor's phase 2 is, and that is essentially everything is fully open. We get lots of feedback on whether or not we should be open and whether we shouldn't, but relying on the medical professionals, the American Academy of Pediatrics, Children's Hospital Denver, they're saying reopen your schools. The healthcare crisis will be far greater as a result of not opening your schools than it would be from COVID. So that's what we're doing. So then within phase 2, there's lots of different models out there. What we really elected to do is we're going to open up, and if at some point we feel like we have to move backwards in phases, we're going to close down. Just for the health and safety of our students and our staff. To me, it just didn't make sense because there's information out there and guidance from these medical professionals that say, stopping the spread of COVID isn't mitigated by reducing the number of students in a teacher's classroom. If one person has it, whether they're masked or socially distanced or whatever it is, you're still going to have spread. What you're trying to do is mitigate that. And so, for us to be able to open fully, there's no way we're going to be able to put 6 feet between people in a classroom. It's not going to be possible. But I was on a Zoom conference call today with some of the members of the Montana chapter of the American Academy of Pediatrics, and they said 6 would be great, but 5 is good. Like if 6 is your best, 5 is good, and 4 is better than 3. So whatever you can do to maximize that, that's what you need to do. Right now our guidelines for phase coverings, the governor came out with an order mandatory in public-facing businesses, but it did not apply to schools. So there again, we had a situation where you put out this mandate that's applicable to everything but schools, and it's become a local control decision. When we first started off, we weren't requiring face masks or recommending or providing face masks. And then as time has gone on and more science has become available to us, we're finding out, our last iteration was face coverings are strongly recommended and may be required. And I think in our next iteration, you're going to see some sort of requirement for at least our 6 through 12, and then a strong recommendation for grades K through 5. And again, that's coming from the Montana pediatricians.
So a couple of follow-ups on that. What's your trigger for deciding to close schools down? What will trigger that decision?
That's a great question. You know, we talked with the hospital, with county health department, with that large group of people, and asked them what their metrics were for determining a movement from phase to phase under the governor's order. And the governor said we're in phase 2, and that is going to be a local control decision. And so what the county is going to look at in terms of metrics could be really skewed. If there was an outbreak of COVID, say at the Veterans Hospital in Columbia Falls, you know, so suddenly there's 20 cases, that doesn't necessarily impact a school. And so we can't rely on the same metrics from the county and what they're looking at and what the hospital's looking at relative to what metrics would apply in schools. And so what we're really looking at is what is our capacity to find, you know, if let's say you're a teacher and you contract COVID and you're out for 2 weeks, what is our capacity to find a single teacher for 2 weeks to be a substitute teacher? And then what if you have 3 or 4 teachers in a building? That could be a quarter of your staff in a smaller elementary school. You know, so we're going to really have to identify some metrics that fit and are tailored for our district, because it could go building by building and it could go district wide, just based on what our capacity is to handle that.
So, and to a certain sense, it's still in development, those metrics and what you're looking at.
Yeah, we just had the conversation with the county asking them for their metrics. We've started to create a document, but again, it's going to be going back to those medical health professionals. You know, so if, let's just say at the high school level, one student tests positive for COVID, and the county is going to do the contact tracing, and they identify 6 students in that high school student's first period class. And then you multiply that times 7 periods. Now you've got 42 kids, and how many teachers? And at what point do you say, okay, we can't, this isn't sustainable? And then the county has to evaluate whether or not we should close the schools for 2 days to do a deep clean. You know, do we send everybody for 14 days? There's a lot of questions and not a lot of answers at this point on some of those topics.
Then on the masks, obviously that's a hot topic. There's a lot of folks who have a lot of divergent views on it. Some folks, you know, surprisingly, sometimes I'm shocked what becomes political, but somehow masks have become political in this environment. But what's the plan if there are students or families who refuse to comply with any kind of mask mandate at schools? Do you have a plan for that, or?
You know, I don't know that we necessarily have a plan. You know, and obviously we have to respect divergent viewpoints in our positions, you as a counselor and me as a superintendent. But I think what we're really looking at is for the overall health and safety of our students and staff. You know, we're talking 6,000 kids, 750 adults that work in our buildings, and we have to make some decisions around that. And you know, one of the things when the question has come up from parents, like I might have a parent send me an email and say, if you require masks, I'm not going to send my kid to school. I respect that. If you don't require masks, I'm not going to send my kid to school, and I respect that. But my go-to point that I like to make with our community is that you should not make a decision about whether or not to send your child to school based on a mask requirement, a social distance requirement, how we're cohorting at lunchtime. You need to make the decision based on the health of your family and what you see as tolerable risk, because there is nothing that is 100% foolproof. There is nothing that we're going to be able to do. And part of our challenge is we can control what happens inside the 4 walls of a school, but I cannot control what happens with a parent or a student who doesn't take those risks into consideration when they leave our schoolhouse. And so someone could be easily infected outside in the community and bring it back to our school and cause a spread. So when we're talking about hand sanitation and face coverings and physically distancing and immunizations and all of those things, those are everybody's responsibility. And we have to work within what we have. You know, there are going to be some challenges. There's no question. Some of our building principals are going to be faced with a student who says, I'm not wearing a mask. And okay, well, here's your option. You can either wear the mask or not, but if you choose not to, we can't let you into the building because that is a requirement of our district. We have dress codes. You have to wear a shirt. You have to wear shoes. You can't have profane language. You can't. We set up all those things because that helps with the orderly environment of a school. And when you're managing that many students, and especially in our larger schools, we're going to have some things in place.
So on the online learning aspect of it, I know a lot of folks are questioning, should I do this, should I not? They're wondering, how can I make this decision without having a real idea what that's going to look like, what classes are going to be offered? What's your recommendation for them?
Well, again, it would go back to, don't make a decision based off of what classes are going to be offered or not offered. And part of our reason for that is we have, roughly 300 unique course titles in our two high schools. And there's no way we can offer that level, that Cadillac model of education that we do in person outside of school. As much as people would like us to, it's just not going to be feasible. And so one of the challenges is, well, if I knew what was going to be offered, then I would be able to better make my decision. And we don't know what to offer until we know who is not going to be in person. So again, the decision to not attend in person or to go remote has to be the precursor to what we can offer, because we are going to try and be flexible and offer whatever we can. We have full IB students at Flathead High School. We have AP students at Glacier High School. We have VOAG students. We have kids who are in 3 or 4 music classes. It runs the gamut. And so trying to take care of every one of those is going to be one of our greatest challenges.
So recovery from COVID can take up to 6 weeks. Are teachers being provided extended paid leave if they were to come down with COVID? Is there any changes on that side in terms of teachers and their sick leave, paid sick leave to deal with COVID?
Right now, we're just operating under the current collective bargaining agreement with our employee groups, and we are extending all of the federal Families First Coronavirus Response Act leave that is available to them. Should they exhaust it, they would be able to get into their own personal leave banks, a sick leave bank maybe within their organization. But no, right now there's nothing in that way. And part of the reason is we can't financially, it's not sustainable. We did it in the first quarter or the last quarter of last year. And it really wasn't a huge hit to the district financially, but we know that it's not a sustainable model for any size district to be able to provide that.
And then especially for the younger children, all this with the pandemic, there's a lot of anxiety around it, a lot of fear, with the masks and the rules and the uncertainty of things. Is there any plans for addressing mental health issues above and beyond what's already provided in the schools, particularly for the younger kids?
That's a great question, because we have talked extensively about that. And, what is our role as an educator beyond, the 3 R's? We have an obligation and a duty to care for the welfare of the child, the whole child. And so we are telling our administrative teams and our teachers, we're not worried about benchmark testing in the first couple of months of school. That is not our primary concern. We have kids who are traumatized by this. We have, there's a lot of fear out there, and we have to take care of that mental and emotional side of things with our students. There's going to be learning going on. There's still going to be activities. There's going to be, engagement and all of those things, but we're also going to really have a focus on taking care of kids and letting them know that we still love them, that we want them to be there, that it's equally as hard and difficult on the adults as it is on them. We're just able to process it better. We recognize that there are developmental milestones that have been lost, K through 12. At what point does a child learn about sharing and what it means to share with a peer? Is that kindergarten? Is that first grade? Is it in the first month of kindergarten? Is it in the last month? Like, we've lost some of those things, and developmental milestones at the high school level. I missed my first prom or my last prom, or, things that we do as a society that we kind of take for granted, and we don't necessarily consider when we say we educate the whole child. There's more at stake here than just whether or not I learn my numbers and my alphabet.
Well, good. So we covered a lot of issues here, but obviously this is such a big topic. There's a lot more that could be discussed. For parents and others who have more questions, what's the best way for them to get a hold of you or the school district to get those questions answered?
Yeah, I mean, I take every phone call and every email and respond to them. So they can look me up on the website, call my number, send me an email. And I prefer phone calls to emails because I get tired of typing. And it's better to engage in a conversation, and tone can be inferred in an email in a way that in a conversation, it's better. And it's better to just hear and talk and listen and understand the concerns rather than just here's a robotic reply.
Well, Micah, thank you so much for the work you're doing. I know it's a tough challenge, and I'm hoping for the best, as we all are, this fall in the school year. And I know it's going to be a lot of adjustments and kind of change things on the fly, I'm sure. But I appreciate the work you're doing to prepare in advance for it. So thank you.
Absolutely. You're welcome. And I will say we're excited. We really, our staff, our teachers and our kids and parents, they want to be back in school, and we want to support that and do it in a safe way. But also acknowledge that not everybody feels that way, and we're going to try and provide whatever opportunities we can. But I trust my administrators and my staff, and they're an amazing group of people. So I think it'll be good.
Yeah. Well, thank you so much, Micah. Thanks for coming on the program.
You're welcome, Ryan.